Occupational therapists work with people of all ages, right from birth through till death. Working in many areas, sort of mental health, physical health. Within that, what we do is we kind of look at the things that people want to do, need to do, or are expected to do within their life. So what the occupational therapists do is look to overcome those barriers, and that can be putting in a piece of equipment to compensate for something that they can't do. It could be looking at adapting the activity, doing it in a different way that's more manageable for that person. So for me, I had been working in a doctor's surgery for years. Started off as an office junior and then as a medical secretary. Obviously stuck in an office kind of 9 to 5, Monday to Friday. It just wasn't suiting me anymore. I knew I wanted to go and work with people. It is difficult, but it's worth it. It's definitely worth it, because once you get into that career and you're doing a job that you love, it's really rewarded. So many different areas that you can work in, like I mentioned earlier, sort of physical health, mental health, different age ranges. So I feel like in some ways there could be something for everyone within occupational therapy. It's just finding your little area that suits you.
I went to university actually at the age of 21. So I failed my A-levels twice, and then I did an access course. Managed to get to university eventually to do occupational therapy, and then life happened and some confidence issues, and I ended up not finishing the course at that time. I did various jobs for years, working in offices and Specsavers and things like that, and I really missed it, and I thought I really wanted to try and get back into occupational therapy. So I found a job as an assistant. So for 10 years I worked as an occupational therapy assistant on a stroke ward. There's so many different areas you could work in. So you could work in a hospital, you could work in a school, a prison. There's also the legal side, in the community, mental health, physical health. So maybe just try and think about what you might be interested in. Maybe spend some time shadowing some occupational therapists doing their job. I think it's very rewarding, you know, as an occupational therapist and within the wider team, coming together to help one person to achieve their goals and to live safely and happily.
A typical day in the life of an occupational therapist. Well, for me, I work within an early intervention team, which is first for people that have experiencing their first episode of psychosis. So for me, we work in a sort of team, which is a multidisciplinary team. So I'm one of a number of professionals. And so we meet every morning when we have a discussion about cases that we need to be involved with that day. Because maybe there are people that are in crisis or maybe in hospital that we need to be engaging with. We all have an individual caseload, so we'd be discussing anybody that we need to talk to about. Once that meeting's finished, I would then go on to take time out to then go speak to my individual clients that I see on a daily basis. So some service users I might see face to face, or maybe make meetings and reviews, or plan treatments with, or carry out treatments throughout the day. So we look at the person, the environment and what they're doing, and make a decision about how we can help problem solve from illness, where they can move on and recover safely, well, and reach their full potential. Occupational therapy really lends itself to so many areas of life and so many areas of healthcare and beyond. I myself went on to run my own business in health and social care, which was nothing to do with the NHS or necessarily healthcare setting. It was a private business, and I was able to do that as an occupational therapist. It is a door, an opening to many opportunities. And I think if you explore it a little bit further, you might discover there's something that you can do within occupational therapy. So give it a chance.